What is a typical day like for a PGY3?
So a typical day for a PGY3 really varies on what rotation you are on. The great thing about PGY3 year is you're getting more exposure to some subspecialties within ophthalmology. Day usually starts around 7 in the morning where we have lecture for an hour, and then you're either going into clinic or you're possibly going into the OR. Some rotations you are going into the OR and bouncing back into clinic throughout the day, such as peds. Day usually ends around 5 to 6 or so.
What is unique about PGY3 year?
There are 3 unique things about PGY3 year. The first one is you get more experience within the subspecialties of ophthalmology. We have a dedicated retina, cornea, neuro-ophthalmology, VA, and pediatric rotations, all for the 3rd year resident. The second unique aspect is that's where you begin to transition from a junior resident to a senior resident. Midway through senior year, you start taking senior call, and that's where you become the primary manager for inpatient consultations as well as outpatient consultations and taking weekend senior call. You also get greater experience in the OR in these situations. And then the third unique aspect is that you get more time allotted for research, such as doing your resident research day project, as well as beginning your quality improvement project.
What is your favorite thing about PGY3 year?
I would say my absolute favorite part about PGY3 year is the 3 months off that we have from taking primary consult call as well as senior call. After doing a full year of that during our 2nd year, it's kind of the reward after a busy 2nd year, and you get so much more time off. You get all weekends off for 3 months straight after buddy call. It's
Woo!
Really a great time. Yes.
What is your favorite rotation and why?
It's a really loaded question, as I just started this year and it's August and I've only experienced one of the rotations. Currently I'm on neuro-ophthalmology, which gives you a lot of time and experience to work with patients in the clinic because it is primarily a clinical specialty. I am looking forward to other rotations as well, that being pediatrics, retina, the VA, where you get more dedicated OR time as part of those rotations. What's interesting, I think, about all of these rotations during 2nd year is that they're very unique subspecialties and they all come with their own complex patients with really interesting workups and diagnoses, as well as surgical solutions to fixing their problems.
What is call like for the PGY3?
So the great thing about the 3rd year is that you get the first 3 months off, kind of like what I had mentioned, and then following that you transition into a senior call role where you take primarily overnight and weekend calls, but you are not seeing the patient as primary consult, and your role is to manage and delegate responsibilities and also communicate with the attending on call.
What is your operative experience like?
During PGY3 year, you get plenty of operative experience during the VA rotation, pediatric rotation, and when you're a senior on call. During our VA rotation, that's where you get the initial exposure to cataract surgery, and you actually develop and fine-tune the steps during cataract surgery so that you can own your cataract patients from A to Z. During pediatrics rotation, you get plenty of strabismus surgery. And then as a senior, you take any sort of operative case that comes in through the emergency department or even actually through the outpatient clinic, depending on what that problem may be. So you definitely get a wealth of operative experience during the PGY3 year here at this program.